for a closer look at COVID-19 vaccinations in children, let's bring in pediatrician Dr. Harley Rotbart. He's the author of a new book, No Regrets Living, as well as Emeritus Professor of Pediatrics at the University of Colorado School of Medicine. Thanks for joining us today.
Thank you. Glad to be here.
So explain the importance of this meeting about deciding this recommendation and what this means for children under 12 getting vaccinated in the U.S. in the weeks and the months to come.
This was a critical first step. There are essentially 4 steps in reaching full approval and release of the vaccines, and that could happen as soon as next week if all 4 of these steps are met. This was the first step. This is a group of 18 specialists outside of the government, outside of the FDA, experts in infectious diseases, experts in epidemiology and in pediatrics, who gathered together to review all of the data that Pfizer submitted. And in a 17-0 with 1 abstention vote, essentially a unanimous vote, the experts agreed that this vaccine was worth gaining authorization from the full FDA. They sent that recommendation to the full FDA, which will now consider it as the second critical step in the formal authorization of the vaccine.
So what are some of the key factors that these advisors were looking at when they decided to recommend this vaccine to the younger groups?
Well, the data that the company, that Pfizer, submitted included both efficacy data, that's how effective the vaccine is in both boosting antibody titers, protective antibody titers in the blood, and also in preventing infections among those children who were vaccinated compared to a control group. The committee also importantly examined side effects, and although this was a relatively small group of young people, of children who were studied, the side effects were negligible, and the effectiveness of the vaccine was substantial, both in boosting antibody levels and in preventing clinical infection.
Now, we are seeing that China is preparing to vaccinate children as young as 3 years old. Do you expect other countries to follow China and the US's lead in terms of vaccinating younger and younger children under 12?
Absolutely. And in fact, a number of countries have already approved the Sinovac, the Chinese vaccine, for kids as young as 2 or 3 years old, some South American countries, for example. Others are considering that. And a number of other countries, Israel and European countries, have already stated that once FDA approval is official, and approval is probably not the right word, it's FDA authorization, and there's a distinction between approval and authorization. Once authorization is given by the full FDA, the other countries will follow through with giving vaccines to 5 through 11-year-old children.
Now, as we know, COVID cases continue to spike up and down globally. How important is vaccinating this cohort of children in terms of bringing the pandemic to an end, especially when you have that ethical question of having more at-risk people in other countries that can't afford it who have not been vaccinated yet?
Right. So two very important aspects to that question. The first is how important is vaccinating children to control the global pandemic and the pandemic in the United States. And we really don't know exactly how effective that will be. It depends upon how critical children are in spreading the virus to others in the community, because children themselves, although they can get sick, and they have been hospitalized and 150 or so kids have died in the 5 to 11-year-old age range during the course of the pandemic, we certainly want to prevent that. But the argument that immunizing 5 to 11-year-old kids to stop the pandemic has theoretical and statistical validity, but will remain to be proven once we start the vaccination to see how big an impact that has on curbing the pandemic, on turning the curve down completely. Your second question is also a very important geopolitical question, and that is, what is the ethical how do we resolve the ethical dilemma of giving vaccines to relatively low risk of getting severe disease or becoming hospitalized or dying compared to the rest of the world? And the only answer I can give to that is it really depends upon the government of the United States and the government of other wealthy countries making the decision to send vaccines abroad to where they're most needed. That will likely not conflict with the vaccines that are going to be given to children. There are enough vaccines to go around to the world and to children in the United States. The government just has to make that decision. Today, Moderna, one of the manufacturers of the new vaccines, just announced that they will be sending 10 million doses globally, which is a major development.
Indeed. Well, we do thank you for your insights. Dr. Harley Rotbart there, author of No Regrets Living and Emeritus Professor of Pediatrics at the University of Colorado School of Medicine. Thank you so much.
Thank you.